Okay, we on? Okay, we're on. All right, so in this live we're gonna. Oh, one second. Oh. Okay, all right. So in this live we're gonna talk about manual therapy, and we're gonna talk about it as a whole, as a topic, as an intervention for physiotherapy in its entirety. So we're not going to go into the specifics of individual types of manual therapy, but mainly we're going to discuss the why we need it. So, is it beneficial? Who would it be most beneficial for? What the studies say for and against as to its relevancy, its effectiveness, and its specificity as well. So whether it works for specific types of pathologies and those that it doesn't work as well for. So when we talk about manual therapy, so if we're going to first go for a definition, it refers to techniques that are used by physiotherapists, sports therapists that can directly affect tissues in a way that other conservative and non-conservative, such as surgical measures, can do. So it's basically a way that we can directly affect how we as therapists can interact with someone's tissues. So these different formats could be through massage, soft tissue massage. That could be instrument assisted, with movement, without movement, different gradings of this massage could be petrissage, which is a little bit deeper compared to effleurage, which is more surface level. And each of these different variations have their own reasons as to why we're going to use that. But we're going to talk about manual therapy as a whole, as I mentioned. That is one category in many others, such as mobilizations and manipulations, which manipulations are something that I've done a little bit more chiropractic, done by osteopaths, as a way of taking a joint and moving it towards a more desired end range, and has its reasons in their practice. Mobilizations is something to do with more to do with pain relief and as movement and reducing some stiffness as well. So these sort of categories go under the main category of manual therapy. And first of all, we're going to start off by debunking exactly what it is that these things do. So what we do know it does, based on research, is it is effective in pain relief, and it is effective in manipulating pain. So we can, doesn't mean it's specifically relief, it could be a way of changing pain perception, as well as standard pain relief. So we know there's some objective measures of numerical rating scales. So we're going to take that a number as to what someone before they come into clinic, what their pain levels are at, and then see following what the pain levels afterwards. And usually with research, they see a decrease after manual therapy, whether that's for one or a few sessions of this being done. Secondly, increasing blood flow. So that's again good for homeostasis, which is getting healing. We can't speed up healing, but improving efficiency of healing. Lengthening muscle is another thing that mainly soft tissue massage with forms of movements can achieve. Not too much with mobilizations. Manual muscle energy techniques is one of the things I actually didn't mention before. That is something that can improve muscle length, but that's another thing that we can do. Reduce inflammation and stiffness as well. So if there is any areas of more acute injuries or something that's happened quite recently, we can reduce inflammation that way as well. So those are the things that we know manual therapy can do. Some of the key ones. There are some other things that are a bit more nuanced, but there's what's most important is to recognize what manual therapy can't do, and this is what a number of clients come into clinic thinking that they can, we can correct alignments. Now, even some chiropractors will mention this, that you can make adjustments to any discrepancies between unilateral, so one side or the other. Maybe it's to do with joint length or muscle imbalance, that sort of thing, and create alignments. We know that that's not the case. That's not how it actually works. It's more of a sales tactic rather than actually working at all. Research does not suggest that broad scheme of research does not actually see any improvements or change in biomechanics of how tissues actually work following manual therapy. There are a few studies that do see a change in, let's say, knee joint distance, or subluxations in the shoulder is another example, following dislocations that can be actually changed biomechanically via manual therapy. But this is very, very nuanced. It's very specific, and maybe 0.5% of all manual therapies will be this type. So for majority, we cannot make adjustments. So that's one thing that we need to debunk as a myth. Second is break up scar tissue. You cannot effectively actually break apart scar tissue. Your body can go through different forms of healing, from laying down collagen following injury and remodel that collagen over time, but you cannot physically change that scar tissue. So that's another thing we don't need to realize. A third thing is what people say is to put them back in place. So let's say they're out of a line, you want to put them back in place. That's another thing that does not happen. That's not true. Again, that is something that it's more jargon than physical scientific fact. So those are that's a little bit more of understanding about what manual therapy can and can't do. So now we're going to go into a discussion of, okay, so we know what manual therapy can do with research, but if we were forming an argument as to why manual therapy is even effective in the first place, why would someone get it or why would a certain demographic benefit from manual therapy more than another? Or is there any other form of conservative therapy that's way more effective than this? Can we just skip this completely? And why would it be beneficial at all? So the best way that we can sort of formulate an argument for this is go for and against. So we're going to start off with the for. So why would manual therapy be beneficial? Starting off, basically, we know that there is no evidence that long-term harm can happen from manual therapy. So if someone comes into a clinic and is maybe they're a little bit more sore the day after, and they're a little bit upset about that and unhappy with maybe the service that they've got, that's something that is very short term. There's nothing in research when manual therapy is done correctly. Of course, not every clinic and not every therapist is going to get everything 100% right when it comes to not causing any harm, let's say. But of course, that's not the plan of action. But we know, regardless of what happens, there's no long-term effects to make a condition worse with manual therapy. So we know that that's research that's been done over years. We know that for certain. So, I mean, it's difficult putting that in the for to say that, nothing harm can come of it, but technically there is no harm that can be done. So you're not losing anything by doing manual therapy. Okay, so that's what we know straight away. Second of all, clients will come in with expectations as to what they see as getting themselves better. So some clients come in and very active and say, okay, I'd like to get a good exercise program that's progressive and works on their particular body parts that's the issue, and another demographic might say, okay, they might be very immobile, they might not be very good with movement, exercise, don't exercise much at all. With those that expect more manual therapy, we actually do see a better perception of their physio by the end of it. Now, this is perception. What we do know is if they were to have numbers of outcome measures from, let's put pain numbers, outcome measures of actual movement per joint or muscle strength. So if we were looking at a 1 rep max, for example, as a form of quantifying an outcome measure, we know that those numbers don't actually change compared to a standard group. So if those had manual therapy, outcome measures don't change. But what does change is those who had the manual therapy compared to those who did not. Maybe they have other forms of physio, exercise, etc. They feel like they have got better by the end of it. Now, you might think that's okay. Well, that's just why does it matter if it's not actually true that they've got better? But we must realize that there is a psychological aspect of physiotherapy that we need to consider as well. There are benefits of having a placebo per se. There are benefits from feeling like you're going to get better. That then improves buy-in. It improves your prognosis and your outcome at the end of it, because you are going to take the physio more seriously as a whole, and by the end of it you're actually going to be feeling a lot better as well as objectively a lot better. So that's a second thing about manual therapy. Psychological, it's definitely positive. Now the third point is probably the most important one, and we can go into most depth on this, is there's different types of pain perception. I'd say again, pain perception with the different types of pathologies. Now, what I mean by that is there are some people that in research you would consider being called pain adaptive, and you would have some people, depending on their mental state as well as physical, as pain maladaptive. So the pain adaptive group, their pain can fluctuate throughout their pathology. So they might be a little bit more on the acute side rather than it being years and years, maybe a few months of having pain. They don't have consistent unremitting pain throughout the day. That goes up and down. It can change depending on how active they are. It can change depending on just small changes. Now, we know that with manual therapy, that is where that is the most effective. With those that can actually, the pain levels do actually change throughout the day, we can get that to go down overall with manual therapy, definitely alongside some other forms of physio, but that as well. So it can be a good tool to springboard those that are pain adaptive. So in that demographic, yes, manual therapy is actually going to be quite effective. So the pain adaptive people, that is a positive for them. Now we'll go into the opposite non-pain adaptive, and we'll go in sort of the against manual therapy discussion. But if you're trying to get a client to improve, starting off with manual therapy is always going to be beneficial for those that can actually manipulate and change their pain. So that's something that you can consider. There's not just placebo. It's not just about, it's better. There's no issues with it. There is actually some benefit for those that can change their pain over time. Now, the fourth point, the last point I'm going to make for is what you may be thinking, okay, well, as I mentioned in the initial start of this discussion, was that there were different forms of manual therapy. Some being soft tissue mobilizations, etc., etc. And what studies have found that if you were to look at the long term as well, so most of these things that I mentioned for are quite short term, and again I'll go into the against for this. But if you do look over a 6-month period of therapy, manual therapy, but we do know that there is no major difference between a specific type of therapy for a specific pathology. So let's say if they had a knee issue and you focus on manipulation and mobilization of that knee joint itself, right? So in that specific area, compared to general manual therapy that looked at maybe a whole lower limb, maybe even the upper limb as well, put everything together, hips, calf, hamstring, soft tissue, as well as some mobilizations of the knee. So focusing on everything holistically, there is no difference between those two groups, and both improved. So it doesn't really matter what manual therapy you do, it still can be beneficial. So that's another thing to realize as well. It doesn't have to be too specific to work. So if you want to get a massage, you feel that will make you feel better, go for it, because that's always going to do something rather than nothing. So there you go. Those are sort of 4 points I'm going to put for manual therapy. Now we're going to go into the against category. So how I mentioned the last one just now about the longer term effects of manual therapy, multiple studies have looked at the outcome of manual therapy in the long term over 6-month periods, and there was no difference really found between those that received manual therapy and a placebo group. So for the long term, it's quite difficult to justify having manual therapy alone. So just manual therapy, repetitive week after week, we're not seeing much benefit for this. And that is important. What's important to really recognize that, okay, just getting the same manual therapy again and again, let's say it's just the same type of mobilization at the same grade, so the same level of mobilization, that's actually not good physio, because you want to progress them. You want to manage different at different stages. So after 6 months period, you're not going to see. Oh, hello, Ollie. You're not going to. After 6 months, you're not really going to see that major improvement that you really want to see if you were to just stay at the same type of mobilization. You need to progress. And what comes into the second point is that we know that over time, over 6 months, a more active form of physio trumps a passive one. So just doing manual therapy without any other form of physio is not beneficial. But what can be beneficial, and I'm going back to 4, is that if you do manual therapy for about 2 to 3 sessions out of, let's say, a 6-month period, this is the research is around 6 months rather than just weeks. If you do 2 to 3 sessions and the rest you then progress into more active means, those 2-3 sessions can actually be pivotal to get you to those sessions that involve exercise. So don't debunk those 2-3 sessions. They can be beneficial. But what we do know is, as soon as you get to the active, like the physio is probably going up at this rate in terms of effectiveness for the mobilizations and manual therapy, but then as soon as active, it sort of skyrockets. So ultimately, yeah, if you can get them to be active and off the bed as soon as possible, it's probably more beneficial than not. Third point, opposite to pain adaptive, you've got non-pain adaptive, pain maladaptive patients and clients. Those we're looking at fibromyalgia, we're looking at MS, we're looking at debilitating conditions that basically aren't going to get better no matter what you do. Now, in order to combat this, okay, you're probably thinking, well, if manual therapy doesn't work and they're not really that active, then how can you improve pain? Now, research says that some of the best forms of pain relief are common medication, long plan medication for these clients, and how much you do in manual therapy, really, we're not going to see too much benefit from it. You're not going to improve that much from a mobilization with someone with fibromyalgia. And fibromyalgia, I've spoken in a previous live, it's very debilitating. It's not going to get much better. Would you recommend manual active therapy within sessions? Well, yeah, definitely. But I think it's difficult to say. instead of thinking of it as micro, let me just, for people reading this, watching this afterwards, the question I suppose is, would you recommend a mixture of manual and active therapy within sessions? I'd say that if you're looking at it at a micro scale, so per session, that's probably, if you combine both, in the middle stages, I'd say probably both, even early on as well. But as at the later stages, you probably want to just focus on active rather than both together. So on a micro scale, I'd say that's around the middle stage of a long-term rehab. Either side of that, you probably want a little bit more manual and at the start and a little bit more active at the end. If that makes sense. But yeah, that's to answer that question for that. But yeah, okay. Moving on to the last point. So this is the last point I'm going to make. Is mainly so the question that was posed before was specific versus non-specific types of therapy. Is that if you looked at the other side of that, is if you're not very specific with your manual therapy, how effective is that anyway, right? So if you can't justify one type of manual therapy for a client, then why would the manual therapy be effective in the first place, and why would you choose that one? If there's not much difference there, wouldn't time be better spent on specific types of physio in the form of exercise prescriptions and programs that we do know work with research, compared to ones that might work for each individual one? So if we're being quite specific, if we're trying to get the best out of each session, then manual therapy as a specific way of improving a particular pathology, more times better spent elsewhere. So that's sort of my point for against. Now, if I'm going to put what I think, so am I for, am I against it? I think it entirely goes down to perception of clients. So if a client comes in with a perception of they want manual therapy, yes, I'm never going to say no, we're not doing it. I would always let them have that, but it's also about patient education as well. So we want them to develop that idea of drip feed them their expectations later down the line to say, okay, this, by the end of it, I realized that exercise and other forms of physio was a lot better for me than the manual ones in the long run. So I am a little bit more against manual therapy, I'd say, but it does have its place and it has been used, and I do use it a lot because it definitely helps with client perceptions. So there we go. Any questions, Ollie, mate? But other than that, I think he's still here, but I'm going to call it there. Doesn't look like it. Alright, okay. Gotta call it there. Thanks for